I want to talk to you about something that is happening in society all the time. The older we get, the slower we move. And that is a problem. But we need to answer why is a problem and what we can do about it. At the Institute, we operate around 80,000 people. So very slowly, through all the years, I learned things that they allowed me to interpret and treat patients sometimes in a different way, because I found that can solve the problem. For example, why we become slower in our movements and lose, in general, some balance, and what is the cause and how can we treat it? Well, look at the old people. They move slow and they move with a purpose. If they need to stand up, they immediately calculate if they have something that they can grab to make other muscles to work, because the muscles that they're supposed to pop you up, they are not working well. Why that happen? Well, happens because through life you have a micro trauma to the spine and the nerves. And then that small trauma will create situations where the order from the brain will be obey, but there are areas that will not be able to be transferred. Why that happen? Well, the brain will give an order to move a foot. That order will go to the spinal cord. The spinal cord will give an order to the nerve that is involved in the motion of that foot, and the nerve will give an order to the muscles that are responsible to move that foot. The problem is when that path in any of these areas is being interrupted, you can have different type of problems. For example, if it is on the spinal cord, you may have paralysis. If you have in a nerve, you may have radiculopathy, and you may have a small growing situation where the strength of the nerves are going to practically fail. And that failure can happen in many years, usually between 10 to 20 years. Slowly the nerve start to transmit less and less that information. And not because it's not trying, it's because it's being interrupted. So the brain gives the order, the spinal cord gives the order, and the nerve cannot carry the order in total. So what does that mean? That is nothing more than the compression on the nerves, and that compression on the nerves becomes from mild to probably maximal pressure. When you have a mild pressure, you will have a sensation of some type of a numbness, and you will live with it. When the numbness starts to become more important is when the area, for example, on the foot, if the plantar part of the foot is numb, you will say, well, my foot is numb a little bit on the bottom. But if the problem becomes more intense, we'll start to go up the ankle, the calf, and usually this will start to create a weakness. And when you develop that weakness, now the nerve is functioning only in a percentage. So the impulse that the brain will give to you and goes to the spinal cord, when it goes to the nerve, the information, the order that the brain gives will go to the nerve, and the nerve is affected in 50%. Now the information is going to go to the muscle only in 50%. If you now, this muscle needs to produce 100% to allow you to stand up and cannot, it's only 50%, then you will not only be slow, but at the same time you will calculate, plan what you do to be able to stand up. That is why you become slow. So it's a situation when the order is not effective, and because not effective, the individual will plan to produce the results to stand up, but will do it planning. So will use his arms to help to stand up. Then what is the consequence of that? Well, it's a progressive problem. In the beginning, will help the hands and probably one arm to stand you up. And then you will require both arms to do it. Then you, not even with the arms, you will do it. You will need to have some help. And then if you go farther with the problem, you will not be able to stand up. So you will not be able to walk. That progressive problem is being discussed as why when we get older, we get slower in our reactions, because also the balance is compromised. So when you turn, you calculate in the turn how you're going to do it to avoid a fall. So all these things make then a movement that can be easy become now a very much planned movement. And that planned movement makes you slow. That is why we become slow. What to do? Now we know what happened. And doesn't happen in one day, happen in years. That's why usually we're talking about when you get older, because it doesn't happen when you are 30, doesn't happen when you are 40, neither when you are 50, but around the 60, you start to have some problems. And after that, those problems intensify and create further problems. Now, let's talk about what to do about it. This problem is totally repairable. We can make a person who is sitting in a wheelchair walk in 3 days. What is amazing to say that, But if you know exactly which nerves are affected, and you, with the techniques and procedures that we develop at the Institute, we create surgeries that they are going to create a return the nerve to a functional situation. That will make those nerves now carry the message. The order for the brain will come to the spinal cord send the order to the nerve will send the order to the muscle, but because this time the nerve is sending around 80, 90, 100% of power information, so the muscles are going to perform normal, and the person will be able to walk. That is what we develop in these years here. Techniques of that quality that allowed the individual not only to get better, but at the same time to perform normal. Now, that is why we become slow, and that is what we need to do to return to your youth and your normal activities as a normal person with a normal agility and normal power in your extremities. Thank you.